All right, welcome to the Health Chat, and we're now using a new format. I'm Dr. Greg Nigh.
I'm Dr. Greg Eckel.
And we are now doing, we can't decide exactly what to call it. I guess it's a vodcast.
Yes, our video podcast.
Video podcast.
Coming at you with the visual now.
So for those thousands of you who enjoy listening to us on your MP3 players, we're going to be splitting the audio off and still make that accessible to people. But for the other thousands who really like to sit in front of a computer and click links, you can now click a link and watch us have this discussion. So it's very exciting.
The behind the scenes, the fisticuffs, the arm wrestling that occurs.
There's a lot. We haven't actually figured out all the kind of props that we might incorporate into this whole video thing. But
they're coming.
It'll get bigger and better all the time. So today our topic is that we're going to talk through sports injury and trauma and pain. It's all kind of wrapped into the same topic. Of course, any of those could be split out into individual topics, but really they fit well together because what makes this topic stand out from what we do in much of our clinical work, a large percentage of our clinical work, is that in other situations we're dealing mostly with chronic issues, chronic imbalances, and kind of systemic problems.
Yeah, longer processes, less acute.
With this particular topic, we're really looking at acute issues, and we're looking specifically at connective tissue, unlike when we're dealing with people's respiratory systems and livers and all that kind of fun stuff that we deal with a lot. With trauma and pain, sports injuries, we're looking at tendons and ligaments and what are the unique things that we need to do to make sure that those kinds of tissues get repaired, because it's a different set of therapies in some ways, or a different application of therapies that we're going to think about. And before Dr. Eckel kind of leaps into a whole discussion about how we approach that, we'll just point out the way the conventional world approaches it and why we think that's maybe not the smartest way of doing things. And the conventional world kind of has two major focuses, big thoughts around how you approach treating these things. The first one, of course, is to interfere with whatever is happening so that the symptom goes away. So somebody sprains their ankle, has a torn ligament in their knee. You give anti-inflammatories to block inflammation, or sometimes cortisone shots. All the time seeing people with sports injuries who've gotten cortisone shots in shoulders and knees and backs and all kinds of things, which is block what the body is trying to do to repair this problem.
It is really good at doing that.
It's great at it. The symptom of pain goes away quickly, often. So that's the first one, the first kind of big approach in the conventional world. And the second big approach is to wait. So you kind of, sprained ankle, wrap it, and give it 6 weeks. Just wait.
Yeah, and it'll get better.
Without any kind of focused suggestions around what you might want to do while you're waiting.
To maximize your healing potential.
Right.
Yeah. I mean, just a case in point on this, and I think there is some truth in it, and you can see the approach, right? Nobody likes to be in pain.
Right.
And, now pain is considered the fifth vital sign that you want to get rid of, and as a doctor, you want to stop suffering. And so you can see on the giving of it, you understand, how we got into this process.
Right.
But what you're going to learn today is that is actually slowing down your process, and it actually can create a lot of issues. We see people after sports injuries, their soccer knee injury or motor vehicle accident trauma, where they said, I went into the ER, they gave me the muscle relaxants and the pain medicine, but I have never been better since that accident. It was 20 years ago I was in that car accident, or, I was in my 20s and I had a soccer injury, and I just have never I never recovered, and it's because of that. It's the non-treatment treatment.
Right, the non-treatment. Absolutely nothing has been done to correct the problem that was leading to the pain.
Right.
It's a tragic way of addressing those kinds of injuries because nothing is done to repair.
So
So yeah, talk us through sort of a naturopathic.
So the first thing, when we're kind of grouping all three things here together, sports injuries, trauma, and pain, you can separate these out. We're going to just keep them grouped together. And I'm going to go in the sports motif, as we're coming up into major summer action here. With prevention, you always hear about prevention. You always hear about training, strength training, stretching. Everybody knows about those. Not a lot of people do them correctly. So we're going to talk a little, just real briefly, definitely if you're doing a new sport or activity, you want to train for it. You don't want to just go out there weekend warrior-like and pull your hamstring or your quadricep or throw your knee out or your back. I mean, all too often we hear, oh yeah, I just went out, I'm playing weekend softball, the beer league or whatever, and I threw my back out on the first pitch or, running for the ball. We don't want that to happen to you. So you definitely want to do some light training for it.
And I would also just add in that even people who aren't athletes,
yeah.
If somebody is playing football and they sprain their ankle, we call that a sports injury.
Right.
But if you're gardening and you sprain your ankle, we don't call it a sports injury, but it's the same problem.
It's the same issue.
And so the same kinds of, stretching and making sure joints are being moved through range of motion and all those things for everybody.
A little warm
everybody, has the potential for these kinds of injuries. It's just that in the sports world, you're kind of forcing the issue because you're beating yourself up in some way.
Indeed, yeah. So, warming up, and I think a lot of people do stretching improperly. I think a little bit, if you're any activity that you're doing, get the blood flowing, move around, walk a bit, and then you do your stretches. You got to kind of load the muscles with the blood. And we're going to talk a little bit about the physiology on what is happening around an injury, but you got to warm up, right? Everybody knows that. Mm-hmm. Talking to a friend of mine, he was a chiropractor in Beijing for 33 U.S. athletes. And, he's dealing with these elite athletes. And it's amazing to me. You would think these folks have it together. They've got their nutrition down. They're training well. They're warming up. And what he shares with me is, no, they're just going with what was given to them. It's amazing. They don't care what they throw into their bodies, except for now that they've met him, they're really now aware of it, and, they're breaking records. They're getting gold medals. They're the folks that are winning, New York Marathon, things like that, where they've been taught what we teach people on diet and nutrition. That is a key component of what you put in here really becomes your cells of tomorrow.
Right.
You need to have those proper building blocks. Essential amino acids, essential fatty acids are two of the largest groups that I see people are lacking in their diet.
It really is amazing how just these basic principles around nutrition and certain nutrients that help strengthen the body and facilitate recovery, it's not really incorporated into the sports world so much. Very sort of localized treatments are in there, but not the bigger picture around recovery. Anyway, so we'll continue to talk
just
through these things.
An aside on that, we see now there are some major league sports teams that are incorporating some of the stuff that we talk about. We had the Pittsburgh Steelers when they won the Super Bowl a couple years ago. That's my favorite team, by the way, from Western Pennsylvania. They were taking fish oils, right? I had to put the plug in there.
Yeah, no.
And then my other favorite sport is hockey, and I was going to bring in a hockey stick and club Dr. Nigh on the head, but it's sitting over here on the side. Vitamin D. They're taking vitamin D. The Blackhawks came out of nowhere. This year they're playing in the Stanley Cup Finals.
And it was all vitamin D.
It must be all vitamin D.
No, vitamin D can't possibly hurt.
Right.
So
I think it's interesting that they're kind of, maybe nutrition plays a role. We can get our players healing faster, less injuries. I mean, it makes sense.
And the fact is, we have had local athletes utilizing we do nutritional IVs here, which we've talked about in our podcast before, where we can put all kinds of great nutrients in an IV bag and really give large amounts of these nutrients to athletes who are recovering. And I mean, some they swear by it.